UK Prime Minister Boris Johnson is still recovering after his fight with COVID-19, but 17,000 other people in the UK did not recover and have died because of the pandemic. And now the government is under attack for the way they've responded to this crisis. Simon Bates with this week's London Calling.
Well, the knives are out for Britain's Prime Minister Boris Johnson. He hasn't even fully recovered from a nasty dose of the virus and a life-saving stay in one of our top hospitals. But already, his government's iron grip on the country is starting to loosen. Awkward questions are being asked. Did the British government just watch and do very little as the virus took hold here? Specifically, why was Boris Johnson on vacation in February at his country residence with his pregnant fiancée, instead of chairing crucial meetings of the country's Emergency Virus Committee? Why is there now a dangerous shortage of protective clothing for our doctors and nurses, a shortage that puts their lives at risk? And why does Britain still not have enough testing kits to evaluate the spread of the disease? Accounts are now emerging of Boris Johnson's complacency, while the experts desperately tried to get him to focus on the virus. This is the Health Secretary, Matt Hancock, and some here feel that he's being set up as the fall guy in the inevitable public inquiry that will be held when all this is over. But the buck surely stops with the man at number 10 Downing Street. Throughout his life, Boris Johnson has made it through tough times by playing it for laughs. To start with, nobody criticised his handling of the virus. It just didn't seem fair or patriotic to challenge him in the middle of a crisis. But now, with more than 17,000 people dead, the mood is changing, and the questions are pretty simple. Is Boris Johnson really the right person to deal with this appalling set of circumstances? And if he isn't, who is? That's London Calling from CBS News. I'm Simon Bates in Devon.